It's time to enhance the relationship between expertise and impact, between knowledge and application. Welcome to a journey of discovery and empowerment. Welcome to All Physicians Lead, the Forbes Books podcast that highlights the critical leadership role that all practicing physicians take on every day. Here's Dr. Leon Morse.
Welcome back to my conversation with Dr. John Studdard, a pulmonary and critical care physician for more than 40 years. We've talked about how his Southern upbringing shaped his perspective on rural healthcare disparities and using his voice. John, you had lots of leadership opportunities with the American College of Chest Physicians. What experiences encouraged you to pursue that pathway, coming as you have from a private practice environment?
Early in my private practice, I had a bunch of great mentors at the Mayo Clinic. Probably my most best friend and most meaningful and impactful mentor for me was Dr. Ed Rosenau, who Lisa knew very well.
I've met, yeah.
Ed was a gentleman. He was brilliant. He was a great sense of humor. A lot of people didn't realize that. And he and his wife, Connie, were great friends to Nancy and I when we lived in Rochester. He was assigned to me to be my counselor or whatever, was assigned to me my first quarter I was there in internal medicine. And so he had a huge impact on me. He was active then. I don't know that he had been president yet of CHEST, but he was acting. And Mayo was weird in that we had about 25 pulmonologists. About half of them were very American Thoracic Society oriented, the ones who were more lab oriented, and the more clinically oriented people were more chest related, which I certainly was more clinically related. But Ed Rosenau was a guy named Doug Gracie, who'd come from Northwestern in Chicago to Mayo. He and his wife became great friends of ours. He was a mentor. He was real active in coding, billing, and reimbursement, that sort of advocacy at CHEST back in the late 70s when I was still at Mayo. And I remember seeing him in an annual CHEST meeting. I said, I'm kind of interested in that kind of thing, Doug. His name was Doug Gracie. If you ever need somebody from a private practice perspective, he was a committee of one then with our attorney. He said, well, why don't you start coming to the committee? So I joined that group. They decided then, after Doug had been chairman for about 15 years, he shouldn't be chairman anymore. And that became I can't remember what we called it, public affairs, government affairs. It changed names several times. And so I got involved in that with CHEST, even though I was in private practice, because of being referred there by my Mayo mentors. And they, I'm sure, facilitated that. I eventually became chairman of that group and was getting ready to rotate off when Attorney General Mike Moore in Mississippi led the attorney generals and were starting that lawsuit against the tobacco industry. I knew Mike, who's a little bit younger than me, because I took care of one of his parents, and I had met him when he first ran for state attorney general, because I didn't care for the older guy he was running against. Mike was young, was from the Gulf Coast, and was pretty outspoken, and I could relate to a lot of those things. And I gave him maybe $100, which was a lot of money for me to give a politician. And we developed a friendship, and so he pulled me in, and I pulled CHEST in, and that's how our involvement in the Attorney General's master settlement started. That's how my leadership started at CHEST. And then, I was at the busiest time of my life then in practice, because our practice was exploding. I was a practice, whatever I was. I was the one who had to run the clinic, run my practice. And look, I wouldn't have wanted anybody else to have done it, though, Leon, so I'm not complaining about it. And the president of CHEST then was a guy named Jim Mathers from Richmond. He was private practice. I'd known Jim. I'd gotten him involved in our government affairs committee. This was 10 or 12 years later. He said, John, would you ever be interested in being on our foundation board? And so I said, sure. There was a time in my life I had a little more time, and that wasn't terribly time consuming at that point in the history of the foundation. And I got to do that, and it was a great experience. Stephanie Levine was president of the foundation right before myself, and that's where our wonderful friendship started. Just a wonderful person, great husband, great family. And we she asked if I would be interested in being president after her. So I, of course, talked to my wife about it, talked to my practice about it. Everybody said, sure, wife first, practice second. Then I won't get into the down and dirty of things. Later on, when I sat on the Board of Regents for 2 years by virtue of being president of the foundation and saw that process for the college, and there was some concerns about the non-volunteer leadership of the organization at that point that I shared, and people encouraged me to run. There were a few people I would never have run against who I talked to first, one of which was your wife, and one was Stephanie Levine, and two other people. I won't drag them into this conversation. And they were not going to run and encouraged me to, and I did. And I was like the dog chasing the car. I didn't really know what to do when I happened to be chosen. So I went from Board of Regents to the leadership track there, which was 4 more years. So great experience. So
yeah, really, really great people. I mean, having met so many, what a great organization.
Oh, and
easy to be involved, collaborate with those folks.
And before COVID, when we were meeting, face to face and with all our meetings, I always had a post-meeting depression because I was such close friends with so many of these people that happened to be in our leadership, and I knew I wasn't going to see them again probably for 3 or 4 months.
So you talked a little bit about the master settlement agreement. Talk about physicians advocacy, how that enriched your career, advice for other folks who are interested in doing things like that.
Well, I kind of got somewhat less active in advocacy for a period of time, just because it's just a matter of time. I mean, you only have so much time, and when your kids are young and play sports and do all the things that they do, we only had 2. Y'all had 15 kids, I think, or 4. Anything more than 2 seems like 15.
It is.
Yeah, and it's wonderful. But as my wife says, because our daughter has 2, that's enough, because then there's always one person to hold each child. I said, well, I could hold 2 children if I need to. But I really got more interested in policy and advocacy really through chess, because chess kind of came back to the policy and advocacy table. And about 3 or 4 years ago, and it was in my past president year, and our CEO, Bob Masacchio, said, John, I think we made a mistake when we got less involved in policy and advocacy, because we've taken ourselves off of the table in some conversations that I think it would help chess to be part of that conversation. And I said, well,
Sure.
I would agree with that. I think all physicians are advocates. If we're not I've said this a million times, if we're not advocates for our patients, I would argue, I don't know that you should be a physician. I think all physicians should understand that they are patient advocates for every damn patient you take care of. So I started doing that work with chest again. And then when I completely retired, I'm a person that needs to stay kind of busy, or I drive my wife and family crazy. I took on this other role, which is all philanthropic, with a group called Together for Hope, who's in the space of persistent rural poverty. And their national office happens to be here in Jackson, and working with great people and how to get involved. This year has been a great example for me, because we are in the middle of arguing for Medicaid expansion in the state of Mississippi. We're one of 10 states that has not expanded Medicaid. If you make more than a certain amount of money, you don't qualify. You can't qualify for traditional Medicaid. And if you don't make 138% of the national poverty level, you can't get in the exchange. So that group, of which about 75% of them are working poor, don't have insurance. And these people have 2 jobs. These folks are, to me, in my opinion, deserving of health care in our country. So we've started with that group. I've been working a lot in Mississippi and in Alabama, and with American Cancer Society's Cancer Action Networks, gotten involved with us on the Medicaid expansion space in the Deep South. And we really been active this year, and all it takes is finding other groups that you can collaborate with and advocate with, whether you're wearing the hat of your state medical association, perhaps, of the local economic council. There'll be other groups in whatever space you're interested in, and just get involved. Join phone calls, go to the Capitol. And at the local level, our son is a healthcare lobbyist in D.C., and I did a good bit of work in D.C. at times, but it's so different at the state level because you walk through a metal detector, nobody cares whether it buzzes or not. And, your people that represent you, they don't represent that many people, and they want to hear from you. They want to see you. And so I've been at the Capitol more this year, really in the last 6 to 8 weeks, than I have in my whole life prior to that.
Nice.
And now, after the first 3 or 4 times down there, people from other groups, whether it's from the American Heart Association, Lung Association, Cancer Society, Mississippi Public Policy Group, State Medical, they see you and they want to know what I know. And so you develop, look, I call it relationships, Leon. I think life is all about relationships. And you develop these relationships with these people, and you find out the people you feel like you can trust, and hopefully they can trust you, and you're pulling a rope in a common direction. And we're probably not going to be successful this year in this state, but we've gotten farther than we've ever gotten before. And so I tell all my younger associates or people I've been working with who are discouraged that, no, you just start doing it again next year. We can do this. So I don't know that there's any real secret to it. I think physicians should all be advocates. Leon, a lot of people will disagree with me on saying this, but I think whatever soapbox somebody gives you, particularly when you're 72 years old and you don't have much time to make an impact, you ought to try to step up on that soapbox and tell your story. Because I think we're all intimately involved with one another. I was just in, and I won't be able to quote this, but came back from Amsterdam and Belgium. So we were on a lot of tours, and up there, what was it? You're the military history guy, Operation Market Garden. We were up in some of the cemeteries related to that, and with a guide. It was so powerful in some museums. And there was a great quote about when they came for the communists, I wasn't a communist, so I didn't pay any attention. When they came for the socialists, when they came for the Jews, I didn't pay. Then they came for me. There was nobody to stand up for me. I really am a great believer that we're all in this world together. There are lots of things we don't agree on, but boy, I bet there are a lot more things we do agree on. So.
Yeah, I'm with you on that one, and having been fortunate to travel quite a bit and see folks in variable situations and cultures and languages. But there are so many things that I've always thought we all have in common that dwarf those things, not to minimize the points of friction, but it just seems like we could do better at solving things if we focused on our commonalities as humans.
I'm a big believer in non-dualistic thinking, and I'm preaching to the choir here because it's my way or the highway kind of guy, and a lot of my life. I hope I'm not now, and but I do. I think physicians' role in communities, Leon, it's different now than it was 40 years ago. I understand. In the old days, a physician, particularly in a small town in Mississippi, the Chevrolet dealer and the doctor were probably the two most well-respected people in the community. And even in a community the size of Jackson, we're only about 250,000 people, so we're pretty small. But physicians had a level of respect. Sometimes they probably didn't deserve, but people cared what we thought. I think I'm enough of a traditionalist. I think people do still care. And I think we have a social responsibility in that role. And again, it's, my family, nobody in my family agrees with each other, much less might be listening to this podcast. My son's a huge Republican lobbyist. My daughter's way out there on the left, Democrat. I'm from Mississippi. I have friends who call me their favorite communist. I certainly don't think that's the case, but at least I'm their favorite something.
You got number one on something.
Yeah, there's so much more commonality, and I agree with the way you put it. I wish we could all emphasize more. I think that's part of leadership too, Leon. You'd have to teach me that, but trying to find the commonality of whatever group you're leading. Golly, your book's great. I sure wish there were a way. So many things that we're doing better in medicine, like environmental sustainability and some other issues that are social determinants of health, which I never heard anything about when I was in medical school. But now they're teaching a lot more of that and leadership in medical schools. But maybe they have more time to do it then. But my goodness, it would be a huge positive if we could carry that through all the way up our education training, but also from our associations. I think have a huge responsibility in that regard. You talk about that towards the end of your book, and I think I think there's a real need in that space. We're doing it some. I mean, you've taught leadership at Chest, and our friend at Cleveland Clinic has had that traditional leadership course that Lisa frequently participates in, and he's great, Dr. Stouffer, and that's good. I just don't know how longitudinal that is, ongoing. I think there are better ways to do that. I'm not an educator, but there are a lot of great educators at all these associations ought to be able to tell us how to do it. So.
Yeah, and I think that there are bits and pieces, but my ultimate goal is to convince medical schools and residency programs to have a longitudinal view about leadership education for physicians. One of the great things now, and like when we were in medical school, you don't have to memorize all of the facts and be able to have them in your head every minute of every day. You're going to do that, of course, by osmosis, and that's always going to be a key part of the medical school curriculum. But it's not a matter of having to go to the library at NIH and go down in the stacks and pull 6 journal articles to try to come up with, right? I mean, we did all this, and now it's the information is at your fingertips, and the drugs and the doses and the side effects. And so it may be that now, or certainly 20 years from now, the requirement to be able to memorize enormous amounts of information and then be able to pull that from your medial temporal lobe at an instant at the bedside isn't as important as it used to be. So that gives us a potential to open up some space for things that traditionally are seen as soft skills. I don't necessarily like that term because I do think they're important, and I don't want them to be minimized by that phraseology.
I've not thought about that, but traditional medical education, fortunately, part of where we are 40 years later is a hell of a lot better than it was back then because of what you've just said. That's an excellent. I can remember as a junior student being on rounds with the scary chairman of urology, and he asked one of the medical students, well, what was Mr. Moore's potassium? And so he's fumbling with the papers in his white coat pocket. And Dr. Weems said, well, Dr. Moore's, how many patients do you have? He said, well, I have 4. And he said, you can't remember one of the 4 patients' potassium? And he said, what are you going to do when you finish medical school? He said, well, I'm going to go in family practice. He said, well, I would suggest that you should have more than about 2 patients if you can't remember.
Oh, ouch.
This was the whole world of education.
That's what it was like. That's what it was like. Indeed.
And it made an impression on me. I made sure I knew all my potassiums on that surface. But you don't really have to anymore. It's a lot better place. Yep. There should be.
I think there's huge advantages to it.
Curriculums for that sort of professional development.
Of course, my old joke is that, you know how many faculty it takes to change a light bulb? And when you ask that question, the first thing is they all recoil in horror and say, change? Nobody said there was going to be change.
Another famous Leon Morse thing, and you'll probably remember this, and this was before COVID, we've lived on conference calls and Zoom since, but you gave that talk where you showed that video of the conference call and the
Ah, yes.
behavior around the room. The guy's eating his lunch, and the guy is in the back of the room the whole time, but doesn't tell you he's there. What are you doing here? But that's whenever somebody says your name, I remember that session that you gave wherever we were with Jeff.
That's how my claim to fame is comic relief rather than scientific excellence. So I appreciate that. So I'm going to assume the answer to this is yes.
Comic relief is greatly appreciated. So.
We have to. That you think leadership is important. We've talked about advocacy. We've talked about, all of your roles throughout your career, from leading your practice, your leadership roles in the American College of Chest Physicians and now in Together for Hope. What qualities or skills do you think physicians bring? What is important to hone as a physician leader to be successful in these spaces based on what you've done and seen?
I think you speak to it some in your book. We're used to, whether we realize we were leaders or not, leading teams in healthcare. So leading a team at the College of Chest Physicians, I think that's important skill to be able to work in a group and to, a big point I frequently make when people listen to me is the listening is a skill that's probably underdeveloped. And I think for a leader, it's incredibly important to demonstrate empathetic listening skills. I would argue, you need to make the people in the room feel like they're the most important person in that room. But I also think, there are times you'll have to be firm, and times that you have to control an agenda or control a room, and it requires a little different style of leadership. But I think empathetic listening is a underdeveloped skill for most of us, and asking the right questions.
Yeah, we have 2 ears and 1 mouth for a reason.
For a damn good reason.
Right. That's not.
And as you can tell in this 45 minutes to an hour, I'm not very good at keeping my mouth shut. So,
well, this is your time, though. This is exactly what we want. We're learning from your experience and expertise.
Experience, perhaps. Expertise, not quite yet.
The College of Chest Physicians obviously has some interest and expertise in developing leaders, these leader pipelines that they have through various committees, and then the global leadership of the organization. What do you think professional societies can be doing or should be doing more to develop physician leaders, both for their organization and making better leaders on the outside in their hospitals and clinics throughout the country?
I think most organizations are talking about these kinds of things more, which is good. But I think mentorship, sponsorship. I mean, you look at people like we've mentioned a few people, Stephanie Levine, Lisa Morse, their ability to, Dorena Drizio-Harris, those are all three women. Isn't that interesting? Gerard Silvestri, I'll throw a guy in there. These are people that, I don't know if I want to put Gerard in that high of a group or not, but you can tell him I said that. I think Chess is doing a pretty good job of trying to get younger people associated with people farther along in their careers to be mentored by. I really am a great believer that the process of governance of an organization needs to be transparent and very open. I realize there's some things that can't be, probably, but it's just too bad that our board meetings and our committee meetings can't create more of a gallery of visitors if they wanted to come in and listen and not necessarily participate, but at least to observe as a step one. I'm sure all associations are different. I think our only two board meetings, only board meeting where other people would even be there would be our annual meeting. And usually the leadership meetings are before the meeting really starts. I always loved, when I happened to be the chair of that board, having people in the room who weren't necessarily around the table. because I thought I liked our process. We had great people at the table that other people could learn from. I think Chess is doing a pretty darn good job of mentorship, sponsorship through our network organization. Our network structure. I wish there were a way where some of the larger leadership meetings, both of committees and or boards, could be more open and observed, and we could encourage people to observe. I think it would be a good exercise. Formal leadership education, like they do at their annual meeting. I just feel like if it's good, then it should be good longitudinally. And that, I'm an idea guy, not strategic, probably tactical, but who will come up with 100 ideas and probably maybe one of them's any good. I think all the people I work with at Chess, the people who have to be responsible for me, would agree with that. Would agree with the fact that I come up with a lot of ideas and not many of them are good, but
doubt that.
Can't think of anything other than what we're doing, other than those things that might.
Yeah. No, those are great. Let's flip that a little bit. We just talked about what the organizations can do. You've got, young physicians starting out in practice. What advice would you have to them?
Find somebody they know that's, particularly now that we're back in the post-COVID world where we're going to meetings and they realize John's going to Chicago for a board meeting with Chess. They know what Chess and ATS are. If we're involved in those organizations, ask, how do I get involved? It's tough in private practice. It's a time commitment. And I realize that. I found a way to make the time for it when I was younger and still working as way too much probably. But I never could encourage any of my younger people. I kept saying, I have an opportunity to facilitate your involvement in this organization. And they're great people. And they have tons of talent. And they've been leaders in their life. But it's easier in an academic setting, I would think. I say that, and I don't really know that, but I would think it would be because it's just a different relationship with the younger people that you train. But just assert yourselves as a young. Call me. Look, if you want to know how to get involved in Chess, write me an email. I'll be happy to answer it. I'm always happy to meet and talk to people. You can never have enough relationships. I've never seen somebody like Stephanie Levine or Lisa Moore tell somebody they didn't have time to talk to them. Leon, you know that better than I do. They might not have time for Leon that night, but they have time to talk to those people.
That's certainly understandable and very appropriate. So, and if anybody's interested in contacting you, you mentioned an email. Want to throw that out there if they have questions?
JEStuddard@gmail.com.
Easy enough. Dr. Studdard, John, thank you very much for your time. This has been great. I'm sure our listeners will gather a lot of great information from that. We appreciate it. And thanks for all your leadership and patient care throughout the years.
Thank you for your service to your country and your leadership along the way, and your leadership in this very important space. And always happy to talk to Leon Morris, and tell Lisa hi from me.
I will. Thanks again. Have a great day.
You bet.
And that's all for this episode of All Physicians Lead. If you like the show, please subscribe so we can notify you when we launch new episodes. In addition, please take a moment to leave us a review so others can benefit from the leadership insights of our terrific guests. See you next time as we continue redefining physician leadership.
This has been All Physicians Lead. We can all be better leaders, and our teammates and patients will be the beneficiaries. Go to allphysicianslead.com to unlock your potential, sharpen your impact, and elevate your journey. All Physicians Lead with Dr. Leon Morse is a production of Forbes Books.